Hi class, so our last topic for MCN 1 Lec, this midterms part, is the third part, which is labor and delivery. From our previous discussions, we learned about the normal pregnancy. And now, nandun na si mami sa stage na pwede na siyang manganak. Magle-labor siya and the baby is ready to be delivered. Labor actually is a series of events. And when we say series of events, may sunod-sunod na pangyayari and there are actually four stages. These series of events will expel the fetus and all the other products of conception. Now, when should labor start? We know that normal anatomy, normal physiology, full term is at 40 weeks. This means that the baby is mature enough to cope with the extrauterine life. So yun yung pinaka-importanteng criteria para yung fetus malabas na. Ito din yung pinaka-importanteng criteria para sabihin natin na si mommy ay pwede na siyang mag-labor. Okay, recalling the computation of the expected date of delivery, it is exactly the 40th week, which is a total of 10 months. And within that period, we said that the baby is already mature. At ano yung period na yon? Weeks before and weeks after 40 weeks, which is 37 to 42 weeks. Okay, now, what are the theories of labor? First is the uterine stretch theory. Simple lang yung ibig sabihin nito. When an organ is full, it will empty. So, pag puno na yung uterus ni mommy, na-reach na yung maximum stretch niya, ready nang lumabas yung baby. That's the theory. Parang yung bladder natin, no? Urinary bladder, if it is full, maiihi ka na. Mararamdaman mo, kailangan mo na siyang i-empty. It's just like that. Okay? Next is the oxytocin theory. Oxytocin theory says that at the end of the pregnancy, oxytocin is released from the posterior pituitary gland of the mother. At ang nagiging target organ niya at this time ay ang uterus. And then, this hormone will now cause or stimulate the uterine muscles to contract. And when it contracts, magsa-start yung labor. The third is the progesterone deprivation theory. We know that all throughout the pregnancy, estrogen, progesterone, and other hormones are maintained at very high levels. And we also know that the progesterone at that time before labor begins, it's a very important hormone because it quiets the muscles of the uterus. Alam naman natin that the middle layer of the uterus is the myometrium, and myo means muscle, but it should not contract during pregnancy. It's because the progesterone relaxes it or quiets it. So pag malapit nang matapos yung pregnancy, progesterone hormone tends to decrease. At pag unti-unti nang bumababa yung hormone ng mommy at the end of the pregnancy, nawawala na yung nagpapaquiet dun sa muscles ng uterus. Therefore, na-stimulate siya to contract and labor will start. And last theory of labor is the prostaglandin cascade theory. Ito naman, at the end of pregnancy ulit, no, we said that at term, halos 1 litro na yung dami ng amniotic fluid. Average range, 800 to 1,200 ml. And ang amniotic fluid, no, kasama nun ang madaming prostaglandins. And prostaglandins, again, stimulate the contraction of the myometrium. So more prostaglandin at the end of pregnancy, it will further or stimulate also the uterine muscles to contract. Now, yun yung theories ng labor, no? Which means itong mga theory na ito ay ang tinitignan na dahilan kung bakit normally at 37 to 42 weeks ay magsa-start ang labor. Okay, now, what are the signs of labor? There are two general classifications of signs of labor, the preliminary signs and the true signs. When we say preliminary signs of labor, it can occur within about a week or two before true labor begins. Pero pag sinabing true signs, oras na lang yung binibilang. In fact, talagang nagle-labor na siya, no? Oras na lang yung binibilang, lalabas na yung baby. Okay? Let's first start with the preliminary signs. So again, preliminary signs will tell us in about 1 to 2 weeks, pwede nang mag-start yung labor ni mommy. First is engagement or lightening. Sa pregnancy, napag-aralan natin that lightening or engagement is the settling of the fetal presenting part, which is normally the head, to the level of the ischial spine. In the photo, you will see here the pelvic bone, and here is the ischial spine. So, naa-anchor yung fetal presenting part doon sa level ng ischial spine. Kaya nga doon sa McDonald's rule, no? If you remember, ang fundus ng isang 36-week AOG na fetus is up high. The fundus is so high, it reaches the diaphragm, no, or the xiphoid process. Kaya ang nanay nakakaramdam ng shortness of breath. Pero bakit mas mababa dun sa McDonald's rule na illustration, yung 38 to 42 weeks or 37, 42 weeks, mas mababa siya. Kasi nga, pwede nang mangyari ang lightening or engagement. Again, these can occur about 7 to 14 days, sometimes 10 to 14 days before labor begins. Lightening probably occurs early in primiparas because first pregnancy nila yon, very tight yung kanilang abdominal muscles. But in multiparas, it is not as dramatic and usually occurs on the day of labor itself, sometimes even after labor has begun. Okay? Next, preliminary sign of labor is increase in the level of activity. During the previous weeks, lalo na nung 36 weeks, si mommy madalas nagsasabi na meron siyang shortness of breath dahil nga parang naiipit nung malaking uterus yung kanyang diaphragm. Pero suddenly, nagkaroon siya ng feeling na marami siyang energy. This is related to an increase in epinephrine. Why? Because there's a release, no, initiated by decrease in progesterone produced by the placenta. Itong additional epinephrine na ito will actually prepare a woman's body for the work of labor ahead. Kasi very exhausting yung labor process for a mother. And the normal labor process lasts for several hours. Minsan, may mga babae nagle-labor 12 hours or more. Okay? The third is the Braxton Hicks contractions. Again, we learned this in pregnancy. As early as 16th week, may mga babaeng nakakaramdam na ng Braxton Hicks contractions. Braxton Hicks contractions are false labors. False labor. Okay? Ang importante, ma-determine na false siya at hindi siya true. In the last week or days before labor begins, a woman would usually notice extremely strong Braxton Hicks contractions. Okay, again, ito yung table na nagdi-differentiate ng false sa true. We have already learned about this during pregnancy and you just have to recall them. Okay, again, Braxton Hicks is false contractions. The fourth preliminary sign is ripening of the cervix. We mentioned that because of very high hormones also during pregnancy, lumalambot ang cervix ng babaeng buntis. lumipis. And we call this the Goodell sign. Okay? How do we now appreciate this ripening or this softening? If you are not pregnant, the cervix is the consistency of the tip of your nose. So, pag hinawakan mo yung tip of the nose mo, that's how a non-pregnant cervix feels. If you become pregnant because of the very high hormones, lumalambot siya, and we call that Goodell sign. Again, now, from the tip of your nose, you can now touch your earlobe. When you touch your earlobe, obviously, mas malambot siya kaysa dito sa tip of the nose. That's the difference in the softening. Now, itong sinasabi nating ripening, ripened na siya, very ready to become thin and to open. So, from an earlobe consistency ng pregnancy, kapag malapit na siyang mag-labor, kasing lambot na siya ng butter or butter soft. Okay? Now, do not think of a butter in the refrigerator as in butter na para siyang margarine na sobrang lambot. Okay? It's very ripe kapag malapit ng mag-labor kasi ready na siyang bumukas at lumipis anytime. Okay? Again, consistency from a tip of a nose, non-pregnant cervix, lumambot, consistency ng earlobe, pregnancy, Goodell sign, very high hormones, and when it's very ripe and the sign of preliminary labor, it becomes butter soft. Let's now go to the true signs of labor, which means totoong nagle-labor na si mommy, nag-umpisa na yung sinasabi natin na series of events that will expel the fetus. It's just a matter of hours, lalabas na yung baby and all the other products of conception. The first true sign of labor is the true uterine contractions. So dito, na-differentiate mo na agad na hindi na siya false labor, hindi na siya false contraction, hindi na siya Braxton Hicks contraction. Na-determine na siya ay isang true uterine contractions. So how do we again differentiate them? Una, dinescribe ni mommy na ang hilab ng tiyan ay nagsimula sa lower back at nag-radiate siya sa harap. Okay? Pangalawa, no amount of rest, no amount of walking will actually stop the uterine contraction. No? Ano pa yon? Pangatlo, yung frequency, intensity, yung duration, padalas ng padalas, patagal ng patagal yung haba, no? At patindi ng patindi yung nararamdamang discomfort. Another sign na true contraction na siya, nung una nag-umpisa siya na very irregular. Pero ngayon, regular na yung paghilab ng tiyan. And lastly, we really determine its true uterine contraction if the cervix will actually start to open and become thin. Okay, so true uterine contractions na siya. Show. What is show? Show, no, is actually the expelled operculum. Na bakbak, napunit, or natanggal na yung operculum. If you remember, si operculum, siya yung mucus plug na nag-fill up ng cervical canal, which actually served as a protection to all the other products of conception inside. Because the cervix is a pinpoint opening, so natakpan siya ng operculum na nanigas. As the cervix softens and ripens, this mucus plug that has filled the cervical canal during pregnancy is expelled. So, yun yung show. Okay, now, minsan you will see that show is bloody. Kaya minsan we describe it as bloody show. Bakit merong bloody show? The exposed cervical capillaries actually seep the blood as a result of the pressure na inexert ng fetus, hence nagiging bloody siya. Okay? So si bloody show muna yung mangyayari, or mapupunit muna or matatanggal muna yung operculum for the next occurrence to happen. Ano yung susunod na mangyayari? Yun yung rupture of membranes. When we say membranes, yun yung chorion at yung amnion. So, puputok siya. At pagputok niya, lalabas yung amniotic fluid. In a layman's term, ito yung my water bag broke, or BOW, bag of water. Okay? Or sa Tagalog, pumutok na yung panubigan. Ngayon, pumutok lang siya, hindi nawala ang amnion and chorion. Nandoon pa rin yung membranes, okay? And again, if we recall, gaano ba kadami yung amniotic fluid? At term, halos 1 litro siya. So, may lalabas na amniotic fluid. In the photo, you will see that the first shows the mucus plug na dapat mo nang ma-expel. Kasi yun yung nakatakip, yun yung operculum na nakatakip sa cervical opening. And pag natanggal na yan, doon lalabas yung amniotic fluid. So, una muna yung show or bloody show, pero after nun, susunod yung bag of water. Now, there are mothers who does not or do not appreciate the bloody show or show. Ang mararamdaman lang nila o yung makikita lang nila ay yung pagputok ng panubigan. Okay? Ibig sabihin ba noon wala silang operculum? No. Ibig sabihin lang noon halos sabay yung pag-rupture nila. Nung nag-rupture or nung na-expel yung operculum, sunod, lumabas, kasabay na niya yung amniotic fluid. And ang operculum, kapiranggot lang yan, maliit lang yan, kaya konti lang rin yung nag-rupture na capillary, pero i-compare mo dun sa mas maraming amniotic fluid na hahalo dito, so hindi ma-appreciate yung bloody show. Okay, so may mga ganon. Now, amniotic fluid, after rupture of membranes occur, amniotic fluid continues to be produced until delivery of the membranes after the birth of the fetus. So, no labor is ever dry. Walang dry labor. Amnion produces amniotic fluid. Kahit pumutok na yung panubigan, tuloy-tuloy pa rin siyang gumagawa ng amniotic fluid hanggang lumabas yung fetus. Alright? Ang risk lang natin kapag pumutok na yung panubigan, lalo na pag masyadong maaga, kasi minsan may mga babaeng maagang pumuputok ang panubigan. Ang risk lang dito dahil open na siya, intrauterine infection. Ganun din yung prolapse umbilical cord. Si umbilical cord, dahil nga may pagbaba via gravity ng amniotic fluid into the vagina, si umbilical cord maaaring sumilip o maunahan niya yung baby pababa dun sa vaginal opening. And these are actually labor and delivery complications, which are topics for MCN2 already. Okay? Now, andun na yung mga preliminary signs of labor, andun na rin yung mga true signs of labor. Now, these are now the components of labor. There are 4 P's, the 4 components of labor. Passageway is first, and the passageway is the pelvic bone. Ang pelvic bone, kailangan adequate size, adequate contour. Okay? The second is the passenger. Maraming passenger. Si fetus, si umbilical cord, yung placenta, okay, even the amniotic fluid, lahat sila passenger. But the most important passenger, of course, is the fetus. At kay fetus, yung pinaka-importante na dapat magkasya sa passageway ay yung kanyang fetal head or yung ulo niya. Dapat ang fetal head is appropriate size and in an advantageous position and presentation para madali ang vaginal birth. Third is the power of labor. Okay? Nag-start na yung labor, pero paano magsa-start yung labor? Kailangan may true uterine contractions at kailangan may cervical changes. What cervical changes am I talking about? Hindi ito yung paglambot. Kasi pregnancy pa lang, malambot na siya. Yung power of labor na cervical changes na tinutukoy natin dito is yung kanyang pagbuka at pagnipis. So ano yung pagbuka ng cervix? Cervical dilatation. Ano yung pagnipis ng cervix? Cervical effacement. So pag meron niyang two powers na yan, may true uterine contractions at merong cervical changes which is dilation and effacement, labor is successful. Also, the powers of labor are strongly influenced by the woman's position during labor. Kasi kailangan din niyang umire. Kailangan niyang mag-push, and that helps. The fourth component of labor is the psyche. It's the woman's psychological outlook, no? Kailangan nilook forward niya yung labor as a positive experience, even if labor is actually an exhaustive event. Alright? So, isa-isahin natin yung mga components of labor na yan. Passageway. Okay, again, I mentioned that the passageway is the pelvis or the pelvic bone. Sa anatomy, na pag-aralan nyo yung different parts ng pelvic bone. Ang significant sa mothers o sa pagbubuntis o dun sa labor, yung symphysis pubis, yung ischial spine, yun yung mga binabanggit natin along the way. Okay? Now, these are photos showing the pelvic inlet and the pelvic outlet. So, imagine ninyo, sa pelvic inlet, ito yung papasok. Dito, papasok si baby. At sa pelvic outlet, dito lalabas si baby. And in a cephalocaudal order, yung pelvic inlet sa taas, papasok si baby, pelvic outlet sa baba, palabas si baby. And we know that the pelvic bone is not a perfect circle. Okay? Kaya dapat may tamang measurement, dapat tama yung shape, tama yung size, which is well fitted for vaginal birth. What we need to measure, okay, so during first pregnancy, mga babae ay ginagawa ng pelvic examination para ma-check kung well fitted ba for vaginal birth yung nanay. So, ang dapat natin ditong alamin ay yung mga pinakamasikip na diameter. At the inlet or the pelvic inlet in the photo, you can see the anteroposterior diameter. And sometimes the anteroposterior diameter is also called the diagonal conjugate. Okay? So, ito siya. Yan. Anteroposterior diameter. Okay? Or the diagonal conjugate. At the inlet, that's the narrowest. At dito naman sa outlet, the transverse diameter is the narrowest. Which means, anong significance nun? Pagpapasok yung baby sa pelvic bone, dapat kung ano yung pinakamaliit na diameter ng fetal head ay magkasya sa manipis na anteroposterior diameter. Pagpalabas naman yung fetal head, dapat yung pinakamanipis na diameter ng fetal head or pinakamaiksing diameter ng fetal head ay magkasya naman sa transverse diameter pagpalabas na siya. Okay, and later on we will realize how the baby does that. Hindi naman yung nagpapaanak ang gumagawa nun, but it's the baby doing those maneuvers or movements inside. Okay? These are different shapes of the pelvic bone. A gynecoid pelvis is a female pelvis and that's best for vaginal birth. May mga platypeloid pelvis, may mga anthropoid pelvis, may android pelvis, uh, mga shapes din yan ng male pelvis. Okay? But the best pelvis for suited for vaginal birth is a gynecoid one. Okay, the next component of labor is the passenger. Again, I mentioned a while ago that there are many passengers, but the most important passenger is the fetus, and the most important part of the fetus that we need to measure is the fetal head or the fetal skull. We have several bones of the skull. Going back to anatomy again, marami tayong buto, no? But only those essential in obstetrics are the frontal bones, the parietal bones, right and left, and the occipital bone. Okay, why? Because they are the presenting parts. They are normally the presenting parts, which means sila yung madalas na unang-unang lalabas from the vagina. Okay, in obstetrics, minsan may ibang tawag sa kanila. This is the sinciput, vertex, and occiput, or frontal, the parietal, and the occipital. Okay, so here another photo showing the sinciput, the vertex, and the occiput. So pag sinabing sinciput, yung pinaka-presenting part ng kanyang fetal head, it's the frontal bone. Siya yung mismong nakaturo dun sa vagina. Pag vertex naman, it's the parietal bone. At pag occiput naman, it's the occipital bone. Again, the smallest diameter of the fetal head must pass through the pelvis. It should be parallel dun sa diameter ng inlet at saka outlet na shortest diameter din. So again, sa pelvic inlet, anteroposterior ang narrowest diameter at sa outlet, transverse diameter naman ang narrowest sa pelvic bone. Look at the measurements of the fetal skull. So we have occipito-mental. Mental or mentum is the chin. It's 13.5 cm. The next is occipito-frontal. It's 12 cm. The next is suboccipito-bregmatic. Bregma is also the anterior fontanelle. It's 9.5 cm. So, anterior fontanelle is diamond shape, posterior fontanelle is triangle shape, tapos ito yung mga suture lines, coronal suture, sagittal suture, lambdoid suture. But we'll further discuss that sa newborn na rin. Okay? And the fourth diameter is the biparietal diameter, 9.25 cm. So, looking at the four diameters, ano yung pinaka maliit the diameter ng fetal skull? It's the biparietal diameter, which means si biparietal diameter dapat parallel sa anteroposterior diameter ng pelvic bone sa inlet. At pagpalabas na yung baby sa pelvic bone, dapat yung biparietal diameter niya ay parallel din dun sa transverse diameter naman ng pelvic outlet. So yun yung mga movements na gagawin, cardinal movements ng baby na gagawin niya so that the fetal head, which is the passenger, will match the pelvic bone, which is the passageway. Okay? So again, ayan yung mga diameters and how the baby passes through the pelvic bone. May guidance naman yan. If you remember again doon sa ating pregnancy, no, hindi ganon katigas yung pelvic bone at that time because of the hormone relaxin also. No, from the word relax, merong softening of the pelvic ligaments. It will aid in the easy passage of the fetal head into the pelvic bone. Next is molding. When we say molding, it's the change in the shape of the fetal skull as the fetal head passes through the birth canal or the pelvic bone. Okay? Kaya pag tinignan nyo dito sa photo, nasisiksik yung pelvic, yung fetal head, yung fetal skull dun sa pelvic bone, which is irregular shape. So, paglabas ng baby, medyo may molding. Nag-mold yung ulo ng baby na malambot pa doon sa dinaanan niya na birth canal. Ang cause nito ay uterine contractions. But don't worry, minutes after birth or hours after birth, within 24 hours, it should go back to its normal skull shape. Okay, next is fetal attitude. When we say fetal attitude, we talk about the relationship of fetal parts to each other. At ano itong relationship na ito? Kung gaano sila kalapit sa isa't isa. Lalong-lalo na gaano kalapit yung ulo ni baby doon sa chest niya. Okay? The nearer the body parts are to each other, the better. Why? Pag mas malapit yung body parts ni baby sa isa't isa, no? Para siyang nakakulob na ganyan, the baby is smaller. And if the baby is smaller, it will pass through the pelvic bone or the birth canal easier. Unlike yung ang layo-layo ng fetal parts niya sa isa't isa. So, pag mas malayo yung fetal parts niya sa isa't isa, mas malaki lumalabas yung baby. At pag mas malaki siya, mas mahirap siyang lalabas doon sa birth canal. So, there are 4 different types of fetal attitude. Complete or full flexion, which means very close to each other yung fetal parts niya. That's the best fetal attitude. Because when they are very close to each other, when the body is fully flexed, the baby is smaller. At pag ganon, vertex part, no, which is the parietal area of the bone, yun yung mismong nakaturo dun sa vaginal opening. Second is moderate flexion or military attitude. Naka-flex naman pero moderate. Military attitude kasi parang naka-chin up yung baby. Pag ganon, medyo malayo ng konti yung ulo niya dun sa katawan niya. Okay? At ang fetal presenting part na mismong nakadirect doon sa vaginal opening is the sinciput or the frontal bone. Partial extension, ano na yun nandoon sa vaginal opening? The eyebrows. So, medyo malayo na talaga. And lastly, very poor flexion or complete extension. Malayong-malayo yung ulo niya doon sa chest ng baby. Ang nandoon sa fetal presenting part, vagina, kitang-kita mo paglabas ng baby is actually the face. Okay? So these are photos showing the different fetal attitudes. As what I've said, look at the photos. If the body parts are close to each other, the baby is smaller. So, itong litrato na ito, ang lalapit ng body parts niya sa isa't isa, lalo na yung lapit ng ulo niya doon sa chest niya. And obviously, you can see from the photos, pinakamaliit yung baby na yan. Okay? At dahil maliit siya, vertex, full flexion, very easy for this baby to pass through the birth canal compared to the other 3 fetal attitudes. Okay? So, another photo showing the different fetal attitudes. So again, letter A is the best fetal attitude. It's a complete flexion. Next is the fetal station. Pag sinabing fetal station, it's the relationship of the fetal presenting part to the level of the ischial spine. Okay, balikan natin yung ischial spine ng pelvic bone. Ito siya. This level is actually 0 level, and when the baby's fetal presenting part it is at 0 level, the baby is engaged. Kaya nga, engagement or lightening. So, pag sinabing engagement or lightening, ano yung station ni baby? Station 0 siya. At pag sinabing engage or lightening na, malapit na siyang manganak. Sa primiparas, usually, in 10 to 14 days. Pero pag multiparas, minsan, just hours na lang after birth. So, ang baby, kapag nandun siya sa -1, -2, -3, at -4 na level, the baby is said to be floating. Okay? So, una pa yan. Pero kapag mas bumaba pa siya sa level ng ischial spine, dapat nagle-labor na yung mommy na ito. +1, +2, +3, +4. Yung +3 tsaka +4 halos nasa outlet na. Kitang-kita mo na yung presenting part ng baby from the vaginal opening. Sometimes, we call +3 and +4 station as crowning. crowning, crowning. Nagka-crown na kasi lalabas na at kita mo na yung fetal presenting part ng baby. Okay, next is fetal lie. When we say fetal lie, paano yung pagkakahiga ni baby sa loob ng uterus ni mommy? It's the relationship of the mother's long axis to the fetal's long axis. Okay, so first photo shows a vertical or transverse lie, which means yung long axis ni baby ay nakaparallel sa long axis ni mommy. Okay? Pangalawa is a horizontal lie, which means yung long axis ni baby ay perpendicular sa long axis ni mommy. Which of the two lies will favor vaginal birth? It's actually the vertical or the vertical lie. Okay? Now, ang vertical lie ay pwede rin naman na breech or puwet yung nandito sa presenting part. Okay? But right now, evidence-based practice or EINC says even if a breech presentation is on a vertical lie position, hindi pa rin nire-recommend yung vaginal birth. It's because of the many possible complications associated with it. So kahit na vertical lie ang breech presentation or una yung puwet ng baby, hindi pa rin siya best for vaginal birth. So ang best for vaginal birth is a fetal lie with a cephalic presentation. Okay? So, ito na nga yung mga presentation. Pag sinabing presentation, ano yung mismong nakaturo dun sa vaginal opening? Cephalic, ulo ni baby, breech, yung puwet ni baby, or shoulder ni baby. Ano ang lie ng cephalic? Vertical. Ano ang lie ng breech? Vertical din. At ano ang lie ng shoulder? Horizontal. Okay? So, yun yung presentations. What about the positions? So, meron tayong positions. This one. So, again, let's look at this photo. Ano ang lie ng 6 na baby na yan? Lahat ang babies na yan ay vertical lie. Ano ang presentation ng lahat ng babies na yan? Cephalic. Pero, ano ang kanilang position? Okay, when we talk about position, we deal with 3 letters for a cephalic presentation. Okay, so nakikita nyo dito yung 3 letters, L-O-A, L-O-P, L-O-T, R-O-A, R-O-P, R-O-T. What does that mean? The first letter is either L or R. L for left ni mommy or R for right ni mommy. Yung middle letter is always O if the presentation is cephalic. O means occiput. Occiput ni baby. And the third letter is either A, P, or T, which is either anterior ni mommy, posterior ni mommy, or transverse ni mommy. So this simply tells us saan nakaturo yung occiput ng baby. Nasa right or left ba ni mommy? Or nasa anterior, posterior, and transverse ba ni mommy? Okay? Meron din tayo minsan tinatawag na face presentation. Kapag face naman yung presentation, yung middle letter, no, is usually M. Nasaan naman yung kanyang chin? But it is not usual, no? The normal is O for occiput. Okay, so let us look at this middle photo on the upper part. Nasaan yung occiput ni baby? Ayan ang occiput. Okay? Imagine niyo yung buntis na yan, nakaharap siya sa atin. So, nasa loob ng buntis na mommy, tong baby na to na nakaharap sa atin ngayon. So, ito yung occiput ni baby. First question, nasaan yung occiput ni baby? Nasa right ni mommy or nasa left ni mommy? Looking at the photo, nakaharap sa atin yung buntis, nandun siya sa left ni mommy. Okay? That's the first letter now, L. Next, nasaan siya? Yung occiput ba ay nasa anterior ni mommy? Nasa bandang harap ba niya? Nasa transverse ni mommy? Nasa tagiliran ba niya? Or nasa posterior ba ni mommy? Nasa likod niya. Obviously, pantay na pantay siya from the transverse. So, T yung third letter, which is the total opposite of this one, the middle photo on the lower part. Ang occiput ni baby saan nakaturo? Nasa right side ni mommy. Kaya R yung first letter niya. At ano ba siya? Nasa harap ni mommy, nasa tagiliran ni mommy, o nakaturo sa likod ni mommy? Again, saktong-sakto, nasa gilid siya ni mommy, transverse. So, ano naman ang position ng baby na ito? ROT. Okay? So, again, tignan nyo rin tong dalawang photo na ito. Parehong left ni mommy nakaturo, left ni mommy nakaturo, pero ito, nasa bandang likod ni mommy yung occiput, nasa bandang harap ni mommy yung occiput. Okay, please study these photos and you will easily understand. Again, O is always the occiput. Saan nakaturo yung occiput? Sa right ba ni mommy, sa left ni mommy, at the same time anterior, posterior, or transverse. Okay, the second presentation is breech. So, ang breech, ano yung presenting part? It's the buttocks area. Ano ang lie ng breech? It's vertical. Ngayon, may tatlong klase ng breech presentation. Complete breech means both the extremities are flexed. Incomplete breech, one extremity is flexed, one extremity is extended. And frank breech, both extremities are extended. Okay? Now, ano ngayon ang mga ano ngayon ang positions ng breech? Ganun ulit. The middle letter now is capital S, small a. SA stands for sacrum or buttocks. Nasaan nakaturo ang buttocks ng baby? Okay? Kanina, ang nasa gitnang letter ay O. Pag O ang nasa gitnang letter, occiput. So, ano ang presentation nun? Cephalic. Pero ang nasa gitnang letter mo ay capital S and A, sacrum, buttocks. Ibig sabihin, ang presentation nun ay breech. So, tingnan natin ngayon tong photo na ito. Ito yung buttocks area ni baby. Ito yung sacrum ni baby. Okay, the first question is, tignan nyo yung mommy, imagine nyo, so nakaharap yung mommy dito sa side na to. Okay, so ayan yung baby sa loob. Nasaan yung buttocks ni baby? Nasa right side ni mommy or nasa left side ni mommy? Kita naman natin na nasa left side siya ni mommy. The second question is, nasaan? Nasa harap ba ni mommy? Nasa tagiliran ba ni mommy? O nasa likod ba ni mommy? Obviously, nasa likod. So, what is the position of this baby? L, S, A, P. This one. Okay? Kasi yung sacrum ni baby nasa kaliwang side ni mommy yan. Imagine mo lang yung mommy kasi doon siya nakaharap. At nasa likod na part ni mommy. So, L, S, A, P. Okay? The third presentation is the shoulder presentation. Ano ang lie ng shoulder presentation? It's horizontal lie. Alright? Ngayon, meron ulit siyang position. Ano naman ang position ng shoulder? Yung gitnang letter ulit, dun lang magkakaiba. A means acromion process or the shoulder. Okay? Yung shoulder blades. Alright? Mas konti lang rin yung positions ng shoulder kasi wala siyang transverse. If you look at the third letter. So, again, tignan natin tong photo. Yung acromion process o yung shoulder ni baby ang presenting part. Okay? Alin sa shoulder ni baby ang nandoon sa presenting part? Is it the right or the left? Ang mas malapit sa presenting part, left. So, ang first letter, L. And then, imagine nyo itong left acromion na pinakamalapit sa presenting part. Nasaan kaya yan ng mommy? Nasa anterior part ni mommy o nasa posterior part niya? If you look at the photo, nakaharap sa atin yung mommy, ito yung nasa anterior eh. At ito ay nasa posterior part. So, parang mas nandun siya sa likod na part. So, ano ang kanyang position? L, A, P. Okay? Minsan, ang makikita niyong letter sa gitna nito ay S. Kung S lang, scapula. Pero pag capital S, small a, sacrum yon. So, minsan may makikita kayong capital S, shoulder presentation yon. So, position yon for shoulder. Okay? Let's try to look at this photos of twin pregnancies. So, dito tayo sa upper right. Okay? This is twin 1. Si twin 1, ano ang lie? It's vertical. Ano ang presentation? It's cephalic. Anong position niya? No, if you look at the occiput, nasaan yung occiput ng baby na ito? Nasa left ni mommy. At nasa ang banda siya? Anterior part ni mommy. So, ang position niya, L-O-A. Itong baby na to, si twin 2 na binalutan ni twin 1. Ano ang lie ni twin 2? Ang lie niya, if you look at the photo, horizontal lie. Ano ang presentation niya? Obviously, shoulder. Okay? Ano ngayon ang position? So, you have to imagine the photo inside. What's inside? I can clearly see from this, I can clearly imagine from the twin 2's photo inside na right shoulder niya yung pinakamalapit sa presenting part. Okay? Ngayon, nasan kaya yung right shoulder na yon? Nasa anterior or posterior ni mommy? Obviously, nasa posterior siya. So, ang position ni twin 2 is R, A, P or R, S, P. Okay? A for acromion process or S for shoulder. So, you can also try to practice determining lie, presentation, and position of the other babies. Okay? Now, Leopold's maneuvers are a systematic method of observation and palpation to determine fetal presentation and position. At ito ay galing mismo sa inyong skill checklist na i-re-ret them ninyo very soon. There are 4 maneuvers. Okay, the first maneuver is the fundal grip. So, aalamin mo yung fetal part na nandoon sa fundus. Okay, the second maneuver is the umbilical grip or the umbilical grip. Okay, you just have to now determine ano yung part na fetal back, ano yung part na harap or anterior part. Okay? At dito sa second grip, if you feel the fetal back, that's when you can hear the fetal heart tones. The third maneuver is the Paulick's grip. Okay? You just have to determine ano yung nandoon sa symphysis pubis. And normally, dapat, anong maramdaman mo dito? Fetal head. And lastly, the fourth maneuver is the pelvic grip. Okay? Mararamdaman mo yung fetal head kung siya ba ay nandoon mismo. Okay? The 4 maneuvers, I will not go through the steps of the Leopold's maneuver because that's your skill for the RLE return demonstration. But again, Leopold's maneuvers will help the nurse determine fetal presentation and position. Okay, so first maneuver, that's the photo, fundal grip. Dapat maramdaman mo dyan, puwet ng baby. Second maneuver, umbilical grip, maramdaman mo yung fetal back at nasaan yung fetal anterior part. Fetal back, pwede mong marinig ang fetal heart tones. Third maneuver, Paulick's grip. Okay, feel for what's in the symphysis pubis. And the fourth maneuver, the pelvic grip. Okay? Now, ito na yung sinasabi natin na mechanisms of labor. Okay? To appreciate this further, please watch the childbirth video na nandoon posted sa ating Canvas site. That childbirth video will tell you the mechanisms of labor. Okay? Ito yung acronym niya, DEFIRE-ERE. Descent, flexion, internal rotation, extension, external rotation, and expulsion. By watching the video, you will appreciate paano ginagawa ni baby na makapasok ng passageway at makalabas. Okay, ito yung sinasabi ko kanina na meron siyang movement sa loob na sinushoot niya at pinaparallel niya yung narrowest diameter ng ulo niya sa narrowest diameter ng pelvic inlet at pelvic outlet. Okay? These cardinal movements of labor is the passage of a fetus through the birth canal. It involves several different position changes, again, to keep the smallest diameter of the fetal head, which should be in cephalic presentation, to always present to the smallest diameter of the pelvis. Nobody tells the baby to do that, pero yun yung normal na ginagawa niya, mechanism of labor or the cardinal movements of labor. Okay? Third now is the power of labor. So, nabanggit ko nga kanina, there should be 2 powers. True uterine contractions is 1. And cervical changes is 2. But when we talk about cervical changes, hindi lang yung pagnipis, but anong cervical changes ito? Ito yung pagbukas at pagnipis niya. I mean, hindi lang yung paglambot. Pero dapat mag-dilate at mag-efface siya. First is true uterine contractions. The mark of an effective uterine contraction is its rhythmicity and progressive lengthening and intensity. So, dapat yung duration, frequency, intensity, humahaba at nagiging regular. Okay? At may pacemaker ang uterine contractions. That's the myometrium. Basically, because The myometrium contains muscles. Remember this graph? It's a uterine contraction. So, it's a uterine contraction 1, and then ano ito? Relaxation, and another uterine contraction 2. Na-discuss natin ito sa pregnancy, lalo na yung contraction stress test. So again, first curved line is one contraction. This pink straight line is relaxation, and then another contraction. Increment is start na contraction, acme is the peak, and decrement is the end of a contraction. Okay, so dapat duration of contraction is a maximum of 60 to 90 seconds. Hanggang dun lang yung maximum. Beyond that, hindi nakakayanin ng fetus. Kasi kapag nagko-contract ang uterus, always remember that there is decreased blood flow to the fetus. And only a maximum of 60 to 90 seconds, yun lang yung kakayanin ni fetus. Frequency, gaano siya kadalas? Ito lang rin yung pinaka-maximum, every 3 to 4 minutes. So if you look at it, sa isang minuto nagko-contract. Pero sa loob ng 3 minuto, nagpapahinga. Okay, dapat ganun lang yung frequency niya. Okay? With severe uterine contractions, humihilab yung matres. Pag humihilab yung matres, no, there are contractions, the baby experiences difficulty sa circulating oxygenated blood. At kapag sobra-sobra ito, sobrang haba, sobrang tagal, hindi niya kakayanin, baka magkaroon ng fetal compromise. At kaya importante yung test na contraction stress test, lalo na pag na-determine ng pregnancy na hindi healthy ang pregnancy. Because we wanna check doon pa lang sa contraction stress test yung decelerations. And please recall again deceleration, no? Sa 3 deceleration, alin lang doon ang normal? It's early deceleration. Okay? Yung early deceleration, bumababa yung fetal heart rate at the start of a contraction kasi normally naiipit yung head. And why is it normal? Kasi pag naipit yung head, nandun yung cranial nerve 10, vagus nerve, which controls heart rate. Pero, dapat makaka-adjust eventually, kaya dapat yung deceleration sa early lang. Pero pag ang deceleration or yung fetal heart rate decrease happens at the end of a contraction, that's not normal. It's late deceleration. Ibig sabihin, ang compromised placenta or the myometrium. Kapag naman yung deceleration ay nakita at the acme or even during relaxation, that's again not normal. Ibig sabihin, ang nakokompress, umbilical cord. So pag merong variable deceleration, which is that, not normal then. Both variable and late decelerations are abnormal. Okay? Ang normal lang, early deceleration. So please recall that. Next, power of labor, ang cervical changes. So, binanggit ko nga, ang cervical changes, yung pagbuka niya, which is dilation, at yung pagnipis niya, which is effacement. In the photo, you can see, ito yung pagbuka, no, hanggang sa maging 10 cm dilated siya. And yung efface, yung numipis, no, numipis, hanggang napakanipis na niya, 100%. Okay? So, mangyayari ang dilation and effacement kasi sobrang lambot na niya ng cervix, which happens pag true labor na. Going back, no, non-pregnant, tip of the nose, pregnant, earlobe, pero ganitong labor, super soft na siya, butter soft. That's why it can dilate and it can efface. Okay, and the fourth component of labor is psych. So, dito natin tinitignan yung emotional readiness ng mommy. Motherhood is the greatest thing, but it is also the hardest thing. So, dapat prepared emotionally yung mother doon sa normal exhaustion or stress of labor. Okay? Now, to continue, going back to EINC, no, yung MDG dati at yung SDG ngayon. Kaya nagkaroon ng mga evidence-based practices o pagbabago sa method ng labor and delivery is because madami nga yung um, maternal deaths. No, the top 3 causes: hemorrhage, infection, eclampsia. Well, in fact, labor and delivery or pregnancy is a normal physiologic process. So, bakit maraming namamatay? Baka daw kasi may mali dun sa previous na paraan ng pagpapaanak. Hence, meron tayong EINC. So, ngayon, according to EINC, prenatal check-ups as long as the pregnancy is healthy, at least 4 is okay. No, hanggang 4 na prenatal check-up is okay. Kailan dapat unang magpa-prenatal check-up? As we recalled, as long as you learned about the pregnancy, dapat mag-seek agad ng first prenatal check-up. Siyempre, kapag ang pagbubuntis ay hindi normal, mas madalas dapat yung pagpa-prenatal check-up. Importante din yung pagpe-prepare ng birth plan. Ano ang plano nung nanay, nung asawa at nung pamilya. Lalo na kapag dumating na yung oras na magle-labor na siya. Okay? Now, we go to the stages of labor. I mentioned a while ago that the labor is a series of events, and these events will expel the baby and the other products of conception. There are 4 stages at mahaba itong 4 na stages na ito. Okay? First stage, nag-umpisa with true uterine contraction. Kaya nga sabi natin kanina, basta't na-determine mo na true uterine contractions na siya at hindi false, hindi na siya Braxton Hicks, nag-start na ang first stage. Kailan natatapos yung first stage? Kapag ang cervix fully dilated and effaced. Pag sinabing fully dilated and effaced, dapat yung cervix 10 cm na, dapat yung cervix 100% effaced na. Second phase starts with full dilation and effacement. Kailan siya natatapos? Pag lumabas na yung baby. The third stage starts pag lumabas yung baby hanggang lumabas yung placenta. In fourth stage, pagkalabas ng placenta hanggang first 4 to 6 hours after birth. This is actually the immediate postpartum. Pero meron tayong separate discussion ng entire postpartum period. Pero yung fourth stage of labor is the immediate postpartum period. At sa lahat ng stages na yan, yung 4 na stages na yan, pinakadelikado for the mommy, yung fourth stage. Okay? Kasi nandyan yung pagbalik, sudden drop in the hormones. Dito rin nagkakaroon ng normal bleeding. At yung bleeding na yon ay baka maging excessive. Dito rin pwedeng magkaroon ng infection. Okay, so dapat all throughout the 4 stages, well taken care of both si mommy at si baby. Now, EINC. Going back to EINC, meron tayong checklist ng EINC. At yung checklist na yon ay yung inyong checklist sa RLE RETDEM. Okay, please go over that checklist. And that checklist, I will tackle it part by part dito rin sa next slides natin. Okay? EINC both tackles labor and delivery and newborn. So yung EINC checklist ninyo, magiging topic pa rin natin yan hanggang sa newborn part. Okay? But here, yung labor and delivery part is included in this discussion. Also, please watch the unang yakap video. It's also in the Canvas site, or it's also there, no, as I included in uh, the file. Okay? And again, review the INC skill. As we go through the discussion now of the 4 stages of labor, please take note also of the evidence-based practices in the next slides. So makikita nyo dito sa mga susunod na slide, yung mga researches na ginawa. These are evidence-based researches which says ito yung result ng study. So yung previous practice na papalitan. Okay?